Hi everyone, welcome back to this concept capsule. The idea as always remains the same, decoding the high-yield MRCOG concepts in less than a minute. And today's topic, the rectus sheath. So what exactly is the rectus sheath? Rectus sheath is a fibrous tissue network which is enclosing the rectus abdominis muscle. Rectus abdominis muscle is a muscle of the anterior abdominal wall which is mainly responsible for giving the six-pack's appearance because of the presence of serrations in it. And it also runs vertically over the anterior abdominal wall. So the contents of the rectus sheath, it contains the rectus abdominis muscle and the pyramidalis muscle will be present over the rectus abdominis within the rectus sheath. Now note that pyramidalis may not be present in all the women. Now the composition of the rectus sheath will be different above the arcuate line and below the arcuate line. So what is arcuate line? Arcuate line lies midway between the umbilicus and the pubic symphysis. So the arcuate line is about 4 to 5 centimeters above the pubic symphysis. Now above the arcuate line, the composition of the rectus sheath is as follows. The anterior aspect of the rectus sheath is formed by the Aponeuroses of the external oblique and the anterior lamina of the internal oblique. Posterior aspect of the rectus sheath above the level of arcuate line is formed by the Transversus abdominis and the posterior lamina of the internal oblique. If we come below the arcuate line, then the anterior aspect of the rectus sheath is formed by the Aponeuroses of all the three flat muscles of the anterior abdominal wall, which includes the external oblique, the internal oblique, and the transversus abdominis. Posteriorly, the posterior wall of the rectus sheath below the level of the arcuate line is deficient, and the rectus abdominis muscle lies directly over the fascia transversalis. So, clinical significance of rectus sheath. Number one, at the time of doing cesarean section, because when you give the Fannin steel incision, a horizontal incision is given over the rectus sheath, and you will be separating the two bellies of rectus abdominis muscle with the help of the fingers. You have to be careful because behind the rectus abdominis, there's an anastomosis which occurs between the superior epigastric and the inferior epigastric. So you have to be careful not to injure these blood vessels. Also, when you are repairing the rectus sheath, you have to be specifically careful below the arcuate line because you know the posterior wall of the rectus sheath beneath the arcuate line is deficient. So you have to be extra careful in repairing the rectus sheath in this area. The second is pigeon hernia because the site of hernia coincides with the deficiency in the posterior wall of rectus sheath. Third clinical significance is rectus sheath hematoma, which occurs due to injury to the blood vessels within the rectus sheath. And the extent of this hematoma is limited by the posterior wall of the rectus sheath above the arcuate line. But below the arcuate line, since the posterior wall of the rectus sheath is deficient, it can move downwards. And as a result, in order to differentiate the rectus hematoma from an intra-abdominal pathology, you may have to resort to imaging like CT scan and ultrasound. So that was all for this concept capsule. Here's a question for you. Thank you so much for listening, and I'll see you with the next concept capsule. Stay tuned.